my name is Megan McDowell, and I'm so happy to be here today to present this information about human trafficking. I teach at Bernal University. I'm an assistant professor and teach foundations, and I also have started a tech company called Track My Clinical that does online clinical tracking for nursing programs and healthcare facilities. So I wanted to start this presentation with a quote from a survivor. So most of the education that I found related to human trafficking, all the evidence says that it really should be survivor informed, and having that perspective and the voice involved in what we're teaching and what we're talking about is so critical. So at the bottom of the slide, says, I was praying for the nurse to ask me a question that they presented to the hospital. And sometimes, we always say that the eyes cannot see what the mind does not know. And that's so truthful that even though they could be staring at us right in front of us, just because we might not have the knowledge or the information of what to do with the trafficking victim, that we still need to be aware and talk about what comes next. As an educator, I always have to include my objective. So I'll do that on the next slide. But as I was starting my doctoral project related to this topic, one of the articles that I found that was done by Dr. McKinney Chisholm Straker said that retrospective studies showed that 70 to 90% of trafficking survivors at some point they're being trafficked showed up. So they have that healthcare, that intersection with healthcare, and yet most of the time they remain unidentified. So nurses, all healthcare professionals really have limited knowledge about trafficking. It has become in the last few years, especially with the Epstein files and that kind of a hot topic. But a lot of us as nurses didn't get that education when we were in nursing school and potentially as new nurses. And that might lack tools like screening tools and how to respond if we suspect that a patient might be also a victim of human trafficking. I thought this study was really groundbreaking that almost 98% of healthcare professionals in ED settings didn't have any training on human trafficking. And we know from the literature that trafficking victims can show up at any intersection in healthcare, but emergency rooms are the number one place that they go. And then 68% of trafficking survivors interacted with an emergency room department. So considering that so many of them have that intersections with emergency room settings, yet almost 98% of them had no formal training on how to not both recognize and then respond to a victim of human trafficking. So I kind of set off on my DNP project a few years ago, not really sure what I wanted to do. To be quite honest, my background in healthcare had been critical care and cardiology, but a few things happened in my professional career that showed me that this issue was so critical and that we really weren't doing enough in the space of healthcare of helping these victims. I had had a patient that I now know probably was being trafficked at the time, showed up as an outpatient and had someone with him that they didn't really go together. He wouldn't leave him alone. He had some suspicious tattoos. And I knew that there was something off, but I wasn't sure what was going on. And as I got into this, information and research and got involved with heel trafficking, I now know that that patient was probably being trafficked. So I set forth to change nursing practice and to try to help teach not only nurses, but all healthcare professionals about trafficking and really give them the tools needed. Initially, I really wanted to start with a screening tool, this tool that was the best in terms of evidence-based and screening for patients. But I also learned that it was so much more than that, that it's not asking the perfect question, but really creating the perfect environment so that if a patient comes in who's being trafficked, they feel safe to be able to disclose and communicate with us. And when they're ready, then they can reach us, that we can give them those resources to help them. So I did my project in the emergency room department. I created an educational program for all staff, and I also created a protocol so that if a patient came in, it kind of included some of the risk factors and the red flags that they might see with their patients, but also give them tangible things of what they could do. So what they knew and then how to connect them to those resources. And I'll share that with you later in the presentation. In my own project, I was able to get about a quarter of the staff in the emergency room department. And of that staff, 72% had said in my project that they never had any formal training. So pretty much in line with what I had already found in the research. And almost half of the participants had said it was never taught in any of their healthcare programs, whether they were physicians, nurses, We had paramedics, we had certified nurses assistants, but almost half had never had any content. So it was really kind of starting from scratch with teaching them what was essential, what they needed to know. So what I'm going to do today is kind of teach you what I taught them and bring in my project and give you some resources that if a patient comes in, you can kind of have some better things and some tools that you can use. So we know right now that human trafficking is a public health crisis. There are more slaves today, right now, than there's ever been at any point in history. It's the fastest growing global criminal enterprise, and it grosses approximately $150 billion annually. So just to put that into context, that's more than Google, Nike, and Starbucks makes in a year. And there's some estimates that say almost 30 million people worldwide are impacted by trafficking. So if you're here in Georgia, that means filling Mercedes-Benz Stadium 388 times. So it's a tremendous amount of people. So some of the statistics that we've seen have placed Georgia in the top 10 of trafficking rates. I've seen even number 3 and number 4. It's kind of hard to find accurate data. What happens is that with the National Human Trafficking Line, people call in reports, and those reports might have one person involved or it might have 100 people involved. So you can see this is the Polaris heat report. So trafficking has been shown in every single state in the US. Florida, California, and New York have typically been the highest states, in Texas, with the highest prevalence rates of human trafficking. But you can see with Georgia, because of our proximity to Florida, because we have one of the largest airports in the world, because of our national sporting events that are hosted here, FIFA, it's unfortunately a huge hub and hotspot for trafficking in the United States. We know that trafficking happens in Georgia. Just in 2021, Operation Blooming Onion uncovered hundreds of migrant workers that were working in South Georgia, forced to pick onions all day for 20 cents a day and living in unsafe conditions, unhoused, barely had access to food or water, and were forced to work against their will. Just last fall in Georgia, a nurse at Athens, I have to check, at Athens Piedmont Northside Hospital in Macon was able to recognize that a child that came in for surgery was actually being trafficked. And she was instrumental in not only recognizing, but rescuing that pediatric patient. Operation Not Forgotten in 2020 in Fulton County rescued 25 children involved with human trafficking. And there's been a recent court case that was settled last year, a $40 million settlement for a hotel in Atlanta that a victim of trafficking was being trafficked there that was only 16. So unfortunately, it's really happening. And this lower picture shows the interstates. And unfortunately, with Florida and Texas, some of the major interstates run through Georgia, which makes us, one of the highest rates in our country. Some risk factors, I wanted you all to understand the definition of trafficking. So it's not a passive crime. We use the AMP model to understand trafficking. There has to be an action. So recruiting, transporting, harboring someone. And the way they keep them in this cycle is by force, fraud, and coercion. If you have a patient that's under 18, in terms of the law, force, fraud, and coercion does not need to be proven. So it is trafficking, even if force, fraud, and coercion does not come into play. And then the purpose would either be for commercial sex services or forced labor. So just an example, we had a patient that was told by their trafficker that they were going to be moved to the United States for a job opportunity. They were going to get married, they were going to have a job, and that they were going to be able to set up a new life here. And when she found herself here in Georgia, she was threatened with violence, with deportation, and told she now needed to work off. She was in a debt bondage situation with her trafficker, where they wanted her then to work off all the money that it took to get her, the passports and travel and that. And she was unable to escape. And when she was going through her trial, they just asked, "Why didn't you leave?" And she said, "Well, first of all, I was terrified because they told me that I would be in trouble for doing what I did. I would be deported. And also, I didn't want to bring shame to my family." So a lot of these traffickers, will use the vulnerabilities of the victims to keep them in these situations. And sometimes, unfortunately, they become where it's a Stockholm syndrome, where they might be getting needs met by their trafficker. It might be housing, it might be food, it might be healthcare, or whatever, love even. And they have this kind of tortured relationship with their trafficker where they are getting their needs met, so they might not see it that way. So it's really important to understand what the definition is so that we can help these patients. Some of the risk factors are a history of abuse and neglect. Individual risk factors can include mental health issues, maybe unstable housing. Children, a lot of times, if they've had intersections with child welfare or the juvenile system, will put someone at a higher risk. Some family related risk factors is if someone has maybe a dysfunctional family, or if they have a family history of trafficking, or if they lack supportive relationships in their life. Some other social or economical can be either homelessness or unstable housing. It could be lack of a job, financial hardship, social isolation. There's certain groups that are marginalized, like the LGBTQ community, that have a higher risk factor, and then people living in communities with higher risks or higher crime rates. Also, systemic factors, people that lack health care, unfortunately, might get into trafficking because it fits their needs, or rural areas, or gaps in policies addressing trafficking prevention and victim services. So some red flags as healthcare professionals, what we need to look for. To me, one of the biggest things is that you have someone with your patient that won't leave them alone and talks for the patient. That's what happened to me, and it happened many times where we've seen victims come in. So sometimes someone can come in and not be aware of their surroundings, where they are. They might not have any idea, no control over their finances or their personal information. They might have multiple cell phones, hotel keys. If you see suspicious jewelry, branding, tattoos, sometimes it can just be a Sharpie. But a lot of times the traffickers, like a commodity, will number their victims. If you've got a child who's maybe chronically running away from home, or maybe the injury and the explanation just don't add up. These are things that I want you to think about. That could this be trafficking, and what could we do next? Some physical red flags that you might see. Again, these are some of the pictures of tattoos that have shown up on survivors of trafficking. But don't think that everybody with a tattoo, obviously, might not be trafficked, but something to think about. If they have suspicious scars and injuries at various levels of healing, bruising, maybe genital area, if they've had frequent STIs, or maybe soft palate issues in their throat, or dental issues, unusual infectious diseases, or maybe occupational injury from unsafe working conditions. The people that were involved in Operation Blooming Onion had terrible sunburn, they had skin issues, dehydration. So really just looking at the safety in their environment, and also looking at some of these physical red flags that may appear. Again, some environmental red flags. If you have another person who won't leave that patient alone, and from the evidence, we know that it's not always the person who's doing the trafficking that's there with the patient. It might be another victim who's quote unquote told to mind the patient that's also being trafficked. But really, they don't want to leave them alone. They're constantly accompanied by that patient or by that other person. Sometimes if they're living in overcrowded places, if they're not able to take a break or eat or drink at work, and maybe minors experience, with homelessness or not living with relatives or foster parents. So bias in healthcare. So Hollywood has really portrayed human trafficking in the last few years. Movies like The Sound of Freedom and Taken. And it's helped in terms of getting the word out there about trafficking, but I also think it hurts it a little bit because it has us thinking that a patient, a victim, or a victim of trafficking must look a certain way or be a certain demographic. Where in reality, we know from the literature that trafficking impacts everyone. There's been children all the way up to even geriatric patients that have been victims of trafficking. So again, the eyes cannot see what the mind does not know. So it's okay to normalize that we might be screening people, for trafficking that might not fit what we've been told based on Hollywood's portrayal of a human trafficking victim. So from my project, when I really dove into the literature, I was looking for a screening tool that was evidence-based to help find adults that were victims of both sex trafficking and labor trafficking. And when I found the Heal Trafficking website, Heal Trafficking is a wonderful organization that connects healthcare professionals to the tools needed using the the core principles of trauma-informed care to guide. And they created the PAIR tool, which is to provide privacy, educate our patients, ask, respect, and respond. So it allows the patient or the victim of trafficking to be in control. And instead of asking the perfect question, creating an environment that's safe and normalizes, hey, this is happening in our community. We want you to know that we're a safe place. So if that happens to you or anyone you know, we can provide some resources to help connect you and help get you out of that situation or your friends. So the PAIR tool is awesome. It's trauma informed. It helps us empower the patient and really create that safe environment where your patient will feel comfortable, when they're ready. The goal here is not to rescue someone or disclosure, but it is to recognize, support, educate, and offer resources. So the first step is in the PAIR tool is privacy. So I have a lot of nurses and healthcare professionals ask me, well, if someone won't leave my patient alone, well, what do I do? So one thing that you can do is take your patient, maybe say that you need to take them to x-ray or to fill out a form or to collect a urine specimen. And that way you can get the person away from whoever they're with, so that you can create that environment where you can ask the questions. If you have a patient who's non-English speaking, it's really important that you involve a translator, that most hospitals include that. If your healthcare facility has a sexual assault nurse examiner or a SANE nurse or a social worker, that person might be helpful too in ensuring that we're creating that safe environment. Assuring confidentially is really critical. Obviously, we are all mandated reporters, so we need to explain the limits of our in terms of what they can disclose to us because of our being mandated reporters. The next step is to educate. And again, this is to say, we know that sometimes maybe it's a patient that came in for an overdose or someone with a substance abuse disorder. And what you could do is say something like, hey, I've taken care of patients before with this issue, and sometimes they've met the wrong drug dealer that ends up controlling their life and their finances. And I just want you to know that if that happens to you or anyone you know, I want you to know that we're a safe place that you can come to and that we have resources available that can help you. So it's very different in asking those questions like, do you feel safe at home? Is anyone, mistreating you? But it's really, kind of citing why the patient came in, normalizing that this is unfortunately something that happens, but just saying, hey, we're here. And when you're ready, giving them the autonomy to disclose or giving them the autonomy to say, I need some help, we have the connection where we can give them some resources. Now we come to ask. So the two validated tools that I used in my project were the RAF tool, which is for adults, and then I also used the Quick Youth Indicators for Trafficking tool, and that's for minors. And both of these tools are great because they're only 4 questions. They can be used for screening for both sex trafficking and for labor trafficking. But again, the point here is not to ask the perfect question. It's really about normalizing screening everyone and creating that safe environment and using the core principles of trauma-informed care. And this is just a picture of the RAF tool. So some of the questions, there's the 4 on there. In the protocol that I created for my DNP project, I did have these 4 questions on there. So for example, in thinking back over the past experience, have you ever been tricked or forced into doing any kind of work that you didn't want to do? So then just kind of giving the patient some time to respond and communicate with you. And they may not want to disclose. And that's the hard part. We don't know as nurses if we're the first person who've asked these questions to the patient or the 50th, but it might take that 50th time of them feeling safe and getting this information to finally say, look, I'm ready. I'm ready to, get out of this situation and get some help. And then these very similar for the youth, but it has just a couple specifics in terms of with young people. So I'll link these two with my presentation. The hardest part, I think, for me is the respect and the respond. Because some of these patients have been coerced or used fraud or threats of violence, a lot of times they're pretty hesitant to leave that situation because of fear of what comes next. One thing that I think of is there was a patient that came to the emergency room department at a North Georgia health system and said, I need help. I'm being trafficked. And staff really thought they were doing the right thing. They let security know, they called the police, but what they didn't know is that that victim had been told, if you tell the police, you will be arrested and prosecuted and deported. So when they did that, the patient bolted. So it's really important to kind of maybe understand the full picture. I want to say though that it is really the most critical thing is ensuring safety for yourself and for staff members. So there will be situations where you are going to need to involve security and police, but just kind of feeling out the situation and doing that, providing privacy and educating and asking and really asking what the patient needs. So we make no assumption what the patient needs. That patient might just need, a safe place, maybe a shower, maybe a turkey sandwich. So we really don't know, but just creating that environment, but really respecting and responding and putting that autonomy back into the patient. So giving them all the resources that we can. And we're really lucky in North Georgia, there is a slew of resources available and that some will even come to the hospital. So I'm going to be giving you a QR code in a moment here that will have not only the national, but the local trafficking hotline and trafficking resources that you can use. So this is a copy of the protocol that I developed as part of my project. So looking at the red flags, some tips involving the pair tool, asking the questions, and then how to respect and respond. There's a QR code at the bottom right that I have on the next slide that you can scan and please keep, and it's going to have some great resources that you can use. And here's that QR code. So just take your phone and scan that, and it's going to lead you to a Google Doc that has resources spelled out. And there's some that are for youth. There's some that are for women. There's some that are just for men. There's some that are national. So part of my work on the Human Task Force for the state of Georgia, which is part of the Criminal Justice Coordinating Council, is maintaining the hotline and the services in the state of Georgia. So that's referenced first on this sheet. So what can we do? So as healthcare professionals, as a nurse educator and a nurse, I realize that it's so critical that we're really integrating this information throughout all of our healthcare programs and not just one time or one lecture, but threading them throughout the curriculum. So that can start in the beginning stages of nursing school and assessment courses. It can be threaded throughout OB. It could be threaded through mental health, even in high acuity, where we can include simulations, where maybe the simulation was going to be a childbirth, but also maybe that mom unfortunately has been a victim of trafficking. So it can be threaded throughout the curriculum because students really need that repetition of understanding and application. One thing too with healthcare facilities, clinical agencies, that it's really critical that nurses receive this information. So whether that's as a new employee orientation or an annual module, so that you know exactly what policies and procedures are in place in your facility and what are your staff doing to screen, and not only screen, but then the next step, connect them to resources. So really critical. Georgia, I've seen, everywhere, anywhere from third to seventh in the nation for rates. So currently there are 13 states that mandate education on trafficking as part of your license renewal process. So I'm working right now with several state senators and state representatives to try to get similar legislation in our state because it is that critical. Some further resources, Heal Trafficking again. Heal Trafficking is one of those wonderful resources that connects healthcare professionals to evidence-based practice protocols. The National Human Traffic Hotline, again, Georgia has the statewide trafficking hotline where you can make a report. I also like Nurses United Against Human Trafficking, where they have educational modules. And then the HHS houses the Stop, Observe, Ask, and Respond, which is a free 2-hour, you get continuing education hours, but goes you a little bit further in depth in terms of what to look for and how to respond. So that's all I have. I thank you so much for your time and attention. This topic has been really near and dear to my heart. And I know it's a dark topic, but I know that so many great people are in healthcare and nurses, and we care about our patients, and we really want what's best for them. So I encourage you, keep learning. Reach out to me if you'd like to learn more or join our cause. We're always looking for wonderful healthcare professionals on the statewide task force. And let me know if you'd be interested in being part of the legislative efforts that we're doing here in Georgia. Thank you.